Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
And I'm Dr. Nicole Callan.
Okay, today, Dr. Callan, we're talking about a very important topic. So I found a lump in my breast. Like I didn't, but a topic that people are going to be searching.
Yes, a topic that I see quite frequently, actually.
Okay, so someone comes into the office, they found a lump. Where do you start? Because this is obviously a very nerve-wracking topic for a lot of women and obviously some men. That's really, really important.
Yeah, so the first thing, I think if a man wakes up and they feel a lump in their breast, then first thing to do is not to panic. I think that the majority of times that people will feel something, it will be completely benign. However, it should not just be left alone. It should be worked up and assessed by probably starting with your family doctor. So generally I tell people if they're not followed by a breast specialist, then call your family physician, and at that point, if you feel something, your family doctor will examine you, and then from there usually order some imaging to see what exactly.
Okay, so you
is.
found something, then you're going to go to your family doctor, and your family doctor, of course, does their history and physical exam, and then they start ordering some tests. And what would that be? What kind of test do they usually start with?
Yeah, so most commonly that will be a ultrasound as well as a mammogram. So you need both tests. The best analogy I have is that if let's say I'm in a valley looking at the mountains and I can see the whole mountain, that's like a mammogram. The ultrasound.
That's a good analogy.
It's a good analogy.
It is a good analogy.
The ultrasound itself is like being on the mountain and just looking at the area that you're looking at. So you're not going to get, so you really need both, because a lot of people want to avoid the mammogram.
Yeah.
But if you don't do the mammogram, you may actually miss things on the other mountain that the ultrasound would have not seen.
Okay, perfect. So just FYI, the mammogram uses a radiation like X-rays to image something. An ultrasound uses sound waves to image something.
Correct.
To image the mountain. Okay.
So wait a second, so just for me, so is the main reason that we're trying to avoid the mammogram is A, the radiation, but B, also because it's a pretty uncomfortable test, right? I think if such a test existed for men's parts, I think men would just refuse to do it, unfortunately.
Mm-hmm. I completely agree with you that I don't think men would go through mammograms in other
areas,
locations.
Yes.
So you're right, and it's because the idea is you have the breast is dense, and it has, it's made of breast and lobules, and as we age, that becomes more fatty, but that dense tissue is tender. And what a mammogram does is it will actually compress the breast tissue to flatten it all out. And things that don't compress are bad things. And so the more compression and pressure you have, the more you can actually flatten things out. And that's uncomfortable.
It sounds it. Okay. All right. So let's say you've done that. Now you've had, and you said most of the time it's going to end up being a benign finding. Right?
The majority of times it is a benign finding, and then based on what we see will depend on the management that comes next.
Okay. Is it like black and white? It's like, yeah, this is benign, no, this isn't, and you can make your decision like that? Or is there a lot of overlap where it's like, this looks benign, but we should follow it, or this looks malignant and we should follow it or biopsy it? How does that sort of algorithm work?
There are some obvious things, like, so if if it's a tumor, generally I would say those tend to be pretty obvious lesions to the radiologist. Even on examination, if you can feel it, because you won't, well, obviously if you present with the palpable mass you can, but you'll have an idea. Like generally, with experience, you should be able to know what it is. As someone who has never done any breast exams, or you will not know yourself, right?
Okay.
But if you're getting imaging done and it's obvious, most times they will biopsy it at the same time.
Oh,
then
okay, right there, radiology.
Yeah.
Okay.
And then you have lesions that are kind of in the gray zone, and so those often you'll have either an offer to do a biopsy to further assess and determine what it is, and then you have an obviously benign thing, which are the more common things like cysts and fibroadenomas.
Okay. All right, so we've got an algorithm now. You found a lump, you went to your family doc ordered some imaging, mammogram, ultrasound, and then it became sort of something that should be concerning, so it gets biopsied perhaps on the spot, or biopsies arranged. And then from the biopsy, it comes back like a tumor, it comes back benign, or it comes back in the gray area.
Yeah.
And then you get eventually referred to someone like yourself, a specialist in the area, who then, through the physical exam, can really help, can give some information as to the importance of this finding.
Yeah, absolutely. So the entire the medical history, the physical exam, the imaging findings, all of those are so important to make a proper decision about what to do next.
Okay.
And there's so many of the intermediate benign things, the things that are benign, but we don't, like, there are so many lesions that are not cancer, but that you don't, like, you have to decide whether or not you're going to remove them or not if they're high risk lesions, right? So
Okay. Got it. Okay.
that's the gray zone area.
Okay. And then that's where discussion happens.
Yeah.
All right. And we were discussing briefly before the self-exam, women examining their breasts. And that, like a few years ago, was the thing you had to do, everyone had to do. We realize this is a touchy subject, but
Yeah.
can you please shed some light on, is that recommended now? Is it not recommended? And why or why not?
I think there have been some associations that have gone against breast examination, and I understand why. I think that certainly the breast tissue is very dense, and so if you don't really know what you're feeling, then you may panic just to feel breast lobules, and you know, or as your cycle's coming, your breasts get more dense, things are more prominent, so that could create some panic.
Okay.
However, I do feel strongly that women do have this innate knowledge of their body, and so if they're in the shower and something feels different, that needs to be assessed. And so I don't think you should be not examining yourself. I think that you actually should get to know your body, and then you'll know when something is different, right?
Okay. So, and that's something about breast cancer that, you know, a lot of other cancers don't have that, you know, benefit, is that you can examine and you can find the cancer. I mean, good luck trying to feel a lung cancer or
Colon
Yes.
cancer.
I don't care how good the camera is on your iPhone, you're not catching that colon cancer on your
No.
own.
Yeah,
But this
I
at
mean,
least gives
some
you a
lesion, it
hint.
depends on your breast size, though. If you have
Right.
a very giant breast and a deep lesion, you're not going to feel
No,
that.
no. Right, I see what you mean, more superficial one. Okay, so previously the recommendation was that women should do breast self-exams. Now there's some controversy there, but you're kind of recommending that it's a good idea to be familiar with your body,
Absolutely.
to know in case you notice any change,
Yeah.
and don't ignore something if
No.
you do find it.
Yeah.
I think that makes a good point. So for the viewer at home, what are the, maybe say like the top 3 things makes you say, yes, you definitely have to have this looked at? Because like you said, during cycles and during times in your life, your breast tissue is going to change a little bit. But what are like red flags where, like, obviously if you feel a mass that's like 4 inches large or something like that, obviously that's going to have to be dealt with. But
Yeah.
is there something that the viewer at home can say, okay, well, this makes me a little more on the, hey, need to get it checked out side of things, as opposed to this might just be normal?
So I guess to start, the majority of things that people are going to feel are going to be benign.
Okay.
Now, it's hard to say what you can ignore.
Right.
I would say if it's new, it's changed,
Pain?
you don't remember it being there, then you should probably get it assessed by your family doctor. And hopefully you have a good relationship with your family doctor and eventually over time, as you get assessed also, if you tend to be worried and noticing things that are really nothing, eventually that anxiety hopefully will subside, right?
Are they painful? Not necessarily.
Breast cancer, you mean?
Yeah, like if you have a lump that's dangerous, that's not a reliable
It's usually
sign or
not
symptom,
painful.
right? Okay.
Yeah.
Okay, so that's great. Now, basically we've gone through it. You found a lump, you went to your family doctor, you got a history physical done, you've got some imaging done, ultrasound mammogram, and then like we discussed, if there's a finding there, you might have had a biopsy done, and then referral eventually to a specialist, and then you have the benign tumors, the tumors that are malignant or dangerous, and then the whole gray area in between where you're going to have a discussion. But the main thing is, if you feel something, don't panic.
Don't panic.
Not a time to be shy. You got to go to your family doctor, tell them about it, get this investigated. And the breast self-exam thing, controversial, but
I think it can only be beneficial.
it can't hurt.
Yeah.
Okay, anything else?
Yeah, no, in general, I think we have to advocate for our own health, right? Like you kind of said, we all know our body's the best, and if something's different, then it might not be normal, so you need to find out. Okay, well that's an awesome summary. Dr. Callan, thanks so much for being with us. So if you like this video, please like it and subscribe to our channel.
Thanks for having me again.
You are in charge of your own health.
We'll see you next time.